Hello, I'm Dr. Sushma. I'm a consultant pediatric ophthalmologist at Rainbow Children's Hospital, Banjara, Hyderabad. So today I'm going to talk about childhood myopia. So this is the most common condition which we see in children day-to-day practice. What is this myopia? Myopia is also called as nearsightedness. That means the child will not be having a clear vision for distance and smaller objects. So this is called childhood myopia. Why does this happen actually? There are multiple reasons for this to happen, especially the genetic reason. That means if both the parents have high numbers, high myopia, then there is a high chance that child will get an early and high number myopia initially. Other than genetic, there are other multiple factors which may influence. That means like child not having outdoor activity, staying always indoor with no natural light exposure. This is one risk factor. Second thing is continuous near work. That means continuously sitting and reading books, continuously writing, continuously painting, or anything which is done at very close distance, using iPads or iPhones continuously without taking breaks is again a risk factor for this myopia. And other than this, sometimes it can be idiopathic. That means there is no reason why the child should have this myopia. It's just the shape and size of the eyeball which determines this condition. So when should we suspect if the child has myopia? When should you have a doubt that the child is having a blurry vision or myopia? So in pre-verbal kids, if you see the child going very close to the TV or holding the books or any objects very close to their eyes, and sometimes too much of watering in the eyes, or if the child is blinking continuously or rubbing the eyes continuously and using his abnormal head posture, that means tilting the head or looking to one side when he watches the TV, or if there is any misalignment in the eyes, that means our eyes are getting deviated when they are watching TV. So these are some clues which will help you suspect if the child is having a myopia. So whenever you see any child having this kind of warning signs, definitely you have to go ahead and get an eye checkup done. Even without this signs and symptoms, without any clue, still the child can have blurry vision and myopia. So we always recommend every parent to have a regular and routine eye checkup, complete eye checkup. It's not just vision screening but complete thorough eye examination. By the age child reaches 1 year, there should be a baseline eye test. And again at the age of 3 years, that is just before joining their schools. And after that at age of 5 to 6 years. So these 3 checkups are mandatory to detect early sight issues. Once we detect, what if the child has early myopia? So the basic treatment we are going to give is with the help of glasses. Giving a corrective glass will help the child to see better. So glasses are safe. We have now number of safe plastic materials, fiber materials used to make these glasses. So they are absolutely child-friendly glasses which can be used daily by the child if they have myopia. And once they reach certain age, say 13 or 15 years, they can use contact lens. And after 18 or 19 years, they can go for any laser surgery to get rid of these glasses. But using glasses when detected is very helpful for the kid to preserve the vision. So what happens if we don't treat them on time or if we delay use of glasses? They are going to end up a condition called as amblyopia, that is lazy eye. If the child is detected to have myopia and if we are not treating on time, the child will have lazy eye condition where even after like 10 to 12 years, if we don't treat it before, after 10 to 12 years, even if we treat, the vision may not be completely developed. This is called as lazy eye syndrome. To prevent this, it's very mandatory to detect it early and treat it on time. So after the treatment, once we start giving glasses, still there is a chance that the number might increase further with age. So there are some precautions to be taken to prevent further progression. So one thing is, as I mentioned, continuous near activity is a risk factor. So we need to make sure that child will not have continuous near activity. Every 15-20 minutes, you have to give a break for them. Say it's reading, writing or painting or using any gadget. Every 15-20 minutes, they should take at least 1 minute break. That is very important. And making sure the child has outdoor activity at least 1 hour of the day. And also we have some new eye drops which can prevent further progression for this myopia. So if we detect that number is going on increasing on every checkup. So we can start on these drops so that it will halt the progression. And also now we have some new specialized glasses which also will help from preventing the progression. So there are few ways to prevent further progression, but for all this we need to detect it early and treat it on time. That's it about the myopia. Thank you.